Going live. I was glued to it trying to find mistakes. Joining us to dish on how it really went down is Dr. Ray Cummings, the ever so lovely, a dear friend, Linda Dano. Hi, Linda.
Hey, Cindy, how are you?
I'm wonderful.
You didn't see any mistakes?
No.
Well, I made one.
No, well, tell me.
Well, when I couldn't remember the name of the restaurant when I was talking to Carrie, and I said, after I butchered the Chez Pierre, I then said, easy for you to say. That was not scripted.
I saw that, and I thought it was you just like playing.
No, I mean, I was playing. It was just, there was a moment there that it tickled me so that I couldn't say the name that I threw in the thing easy for you to say. But, yeah, that was not scripted.
Well, you know what, Sandy, we got to pull that, and we'll show everybody tomorrow because I missed it. You're good. But in general, how'd it go?
Oh, my God. We were so proud of ourselves. We did it. Everybody was great. The crew, everybody. It's quite a feat to do this.
Well, a lot of people forget, Linda, that, of course the actors are under a lot of pressure, but my goodness, so are the camera people, lighting.
God. Probably more than us. Because they have to whiz up and down that studio. 8 cameras, not bump into each other.
Right.
They can't make any noise.
And I didn't see I was looking for a camera jiggle. But now today, Susan Batten, ex-Luna, we caught her.
Yeah, was that fun?
She made a guest.
When little Eddie says, I see dead people, and all of a sudden there she is.
Exactly. And
they're going to do more of that. You're going to see some more, people that used to be on One Life, and they're coming back.
And also, now, tomorrow, of course, again, is live. And do you have any secrets or hints you can...
Well, I'll tell you one thing. Something really interesting and fun happens with 2 characters that you will not believe.
By the way, Linda, happy birthday.
Thank you, honey.
I know it was yesterday, but did you know mine is today?
Thank you. Happy birthday to you.
Happy birthday. We're good Tauruses.
Yeah, we are.
Anyway, today's episode was really, really good. We're looking forward to the rest of the week.
I think the whole week is going to be great. Gary Tomlin, the exec producer, decided when he wanted to do this not to be careful. So there's lots of stuff going on.
Well, I can't wait. Thank you so much, Linda. Tell everybody I said hi.
I will. Say hi to everybody there.
All righty. Talk to you later.
Honey.
Bye-bye.
Bye-bye.
I feel good when someone calls me honey. Up next, a procedure that many of your favorite soap stars, listen to this, are getting, and it's impacting their acting. Susan Walters, who plays Diane on The Young and the Restless, got Botox. And she said it was really funny trying to make an angry glare in a confrontation scene because her forehead was frozen. More Botox boom in just a second. Don't go away.
What this kind of party is based on, except with your sparkling water and your shrimp appetizer, you get an injection of Botox. We're going to see what it feels like, how much it costs, and why would you do it in a party setting. Liz is our first guinea pig or candidate. She's getting ready to get Botoxed right after this. Cheers, Liz. Cheers.
Have you ever admired the facial feature of a star? Well, nowadays, with all the advances in cosmetic surgery, if you got the money, you can get it. But first, we want to go backstage to our green room where Alisa Jaffe is hanging out. Alisa, I've heard of Botox, but what's the deal with this Botox party? What's happening?
This is the newest rage. Tupperware parties were big, but now in L.A. and even here in Seattle, they're getting Botox done in group settings. It's okay to have to be two-faced, but it's not okay to have a double chin in Hollywood, and it's okay to be highbrow, but it's not okay to have a furrowed brow. So they're mixing their shrimp, hold on, and they're going to these party settings. Dr. Henri Gaborio, excuse me, I've got my mouth full, is going to inject a little bit of Botox in Liz here. And before I ask you what is Botox, why would you do this in a group setting? That's what I want to know from you.
I'm still questioning why.
How scared are you?
Well, look at me. Don't talk.
That's what I hear. I hear people go to these parties and think, oh, it's not going to happen to me. I'm fine. Maybe I'll just go and watch what happens. And then all of a sudden they see one person get it and another person get it, and then they get it too.
I guess that's what's happening. I just follow the crowd.
goodness. So tell me, what is Botox? I mean, I think you're putting poison in her head. That's what it feels like.
It is true. Yes,
it is true.
It is true. It is literally true. This is basically it's a toxin. What we normally it's known under the name of botulism. You know, with the tin can, the old tin can that has been rotten. This is what it is.
So do you still want this botulism eroded tin can to be injected into your head?
I'm committed.
Okay, so now how do we make it safe? And what's it going to do to her head?
It is safe for one good reason, is that the toxic dose is about 3,000 units to arrive to the toxic dose. And we use, like for today, on Liz, we're going to use 15 units. So the safety margin is really big.
Okay.
So there's no side effect of it, and there's no fear. You should not have any fear of having, a total paralysis.
Okay, if you get a little squeamish, don't watch, because he's going to inject the needle in right now. And I want you to describe what it's feeling like as it happens. Yes, you can. You know what? It'll take your mind off while it's going.
What we're going to do right now is that, smile for me, Liz?
Yeah.
Smile. So you can see this is what we call the laugh line, or we call the crow feet. So what we're going to do right now is inject, right here. So we put my finger right here.
Feet and laugh lines.
Small stick.
Okay.
That's
You
it.
want me to talk?
I want you to tell me what it feels like. Does it hurt?
No, it
Small
doesn't.
stick.
It doesn't hurt at all?
No. Well, yeah, the needle, but that's all.
Small stick.
Does it feel like a regular shot that you might get at the doctor?
Yes, it does. It's not that bad.
So basically, I could do a lot more pain if I hit you in the arm on the other side.
Yes. Am I supposed to smile? I could ruin it.
Good.
If she smiles, will that hurt anything?
Not
or-
at all. Not at
We
all.
could go somewhere else.
Hey, Alicia,
Yeah.
everybody is squeamish in here. What are you thinking of this?
Very interesting.
Howard, you got a question? Go ahead.
I'm obviously beyond hope, but my wife was wondering how much one of these Botox parties cost.
I want to know how much it costs.
Yeah, so if you have a party, does it cost for just the party and then everybody gets free shots of Botox, or then does it cost per person and per injection?
Yeah, it costs per person and per injection, and it really depends which area you get. Most of the people get in between the eyes. You can do the forehead, and you can do the crow feet. This is pretty much the three areas that people ask, and each area is different price.
Okay, so if she wanted her brow done, how much would that cost?
It goes between 400 to 500.
Okay, and for the crow's feet?
Crow feet is about 300.
Okay. Now, do you like your laugh lines? Do you like your crow's feet, or is this something when you look in the mirror it bothers you?
Yeah, it bothers me.
It does bother you.
I don't mind some.
Uh-huh.
But not as many as there are now.
So why Botox as opposed to getting surgery?
Because it's not forever. If I didn't like it, it would just goes away after a while.
Let me grab a couple of quick questions, Alicia. Go ahead, Eileen.
You put on a brave face, but I'd like to know how much it really hurt.
How much does it hurt?
How much does it really, really hurt?
No, it really doesn't hurt. That really didn't hurt.
Somebody said it's just like getting a pinch like that.
Yeah.
Here, let me pinch you for a second.
Okay, pinch.
Okay. Is it like that? Pinching you
Yeah.
like that?
Yeah.
Oh, I just did with my nails, pinching her, and that's all it felt like.
No, I'm not just saying that.
Because it's him.
It really didn't hurt. It really didn't hurt. I
Okay,
can't
Susan.
take it that good.
Susan's got a question. Go, Susan.
Not well.
Well, I know he said there wasn't any side effects, but I was wondering, is there any swelling? Can you see where the needle went in?
That's correct, yes. You're going to have some swelling for maybe about less than an hour. For about an hour, you may see some swelling, you may see a little bit of redness, and that's pretty much it. Normally what I tell my patients, for 4 hours you cannot work out. I'm asking them not to rub, the area
So
of the injected.
if you rubbed it, would it maybe drip down and all of a sudden the
That's
poison could
correct.
go here and your face could
Absolutely.
droop?
Yeah, not the face.
Thanks. Well,
But it is-
no, sorry. Don't
it
mean
is-
to scare you.
It is true if you do inject at the level of the eyebrow right here. If you do inject right here and the patient starts, massaging it and pushing it down, it can go right at the level of the upper eyelid, and then you have what we call a tarsus or droopy eyelid. That
All right.
could happen.
Why don't you all continue the Botox party? On the line with us is Richard Fleming. He comes out with the annual Hollywood Hottest Looks. Hi, Richard. How are you?
Good afternoon.
Hey, I want to just go right down some of the lists because we got a Botox party going here, and we got people who are interested in different facial features, and we're watching somebody get stuck here with a needle. What's the most requested star facial feature? Is it the nose?
Well, the most requested surgery is nose rhinoplasty, the nose job. Yes, that's the most common cosmetic operation in
And
the country.
I've heard Nicole Kidman's got the one everybody likes. Is that right?
That, hers, and also Heather Locklear.
How about for men?
For men, for noses, Edward Burns, Antonio Banderas, Ben Affleck.
Good. A lot more options. Now, what would be the next? If you didn't do the nose, what would be the next thing that you see most of?
The next most common procedure is liposuction. But on facial features, it would be eyes. And with respect to eyes, Brad Pitt's eyes are described Heather Graham, Catherine Zeta-Jones.
When you said Brad Pitt, you just went, oh, what was that?
No,
hot.
I was going on to other people.
Hot.
No. Brad Pitt, Elijah Wood, Ewan McGregor. What people are doing, they're not coming in and asking to be like these people. They're taking advantage of public figures to describe a physical feature they like. If I ask you to describe your nose to me on the phone, you couldn't do it.
Mine's the size of a Buick. Hey,
but you still, even if that's the case, you can't describe it to me.
Well, how about
describe to me your favorite painting? You can't. So what people are doing, it's difficult for them to describe a physical feature or describe a nose they want. So they use celebrities and public figures because it's a visual.
Let me ask. I'm going to ask our audience here. How about hair? Whose hair do you like?
Well, he mentioned Nicole Kidman. She's got hair to die for. But then you've got others that are just, gorgeous knockdown.
Somebody said Friends. Jennifer Aniston. Whose hair do people like?
Jennifer was number one on our list this year. Julia Roberts is frequently there. Deborah Messing is always talked about with respect to hair.
How about guys' hair?
Guys' hair, Tom Cruise, Pierce Brosnan.
This lady next, what is your name?
I'm Barb. And
she's saying that just before you're saying it. Tom, Pierce. What is it about their hair? What is it? Just you don't want to? You said you didn't want to look like the star. Does it make them feel better to have that? Do they think they have star quality? Why do people want that?
Are you talking to her?
I'm talking to you. I'm sorry. Go ahead, Richard.
Okay. No, it's just a physical characteristic they like, and if they want hair, if that's what they're going to do, which is much more common among men, obviously, with surgery, they're going to describe these individuals' hair. That's what they'd like to achieve.
Okay, hang on
all
for
we're saying.
Great. Hang on for a moment. We'll talk more. Also check in with the Botox party and collagen lip injections. Yeah, they're going to do that at our party. Coming up next.